Provider Spotlight, where every week we are coming here and interviewing the most amazing private practices from all across the United States. Every week we have a new provider, a new perspective. We have lots of people in all different kinds of specialties, and this is a very unique one, something that we haven't hit on in a very long time. So I'm very excited to introduce you to our very special guest, Dr. Mila Mogilevsky, a founder and medical director of Unique Pain Medicine in New York. So, Dr. Mila, welcome.
Thank you so much. Thank you so much, Richard. Thanks for having me.
Yeah, I am so excited to have you here. I know we have a lot to dive into today, but something that I always like to talk about is, you know, the journey, how you got here. You've been through all kinds of training, like the institutes, like Northwestern University and the
Yeah.
Rehabilitation Institute of Chicago. So, what you've done a lot in a short amount of time. So, what motivated you to be in pain management?
Yeah. Yeah, no, it's a great question. My journey was a little bit different. I'm thinking from a lot of people because before I went to med school, I was actually a physical therapist for a few years. And so I knew what it was like to be injured and to be in pain.
Mhm.
And, while I was sort of working, face to face with patients, I was lacking that medical understanding and that medical component that I felt was necessary to really help people. So I decided to go to medical school and specialize in rehab.
Yeah.
And then took one rotation that was called anesthesia rotation, and they did pain management there. They were doing injections for the patients, and they were, getting them out of pain immediately on the spot. And it's just sounded so exciting, but the angle was that once they got that relief of pain, they were pretty much sent home. And when the patient was like, well, what do I do now, the answer was like, well, I don't know,
I don't
go
know.
talk to your doctor. So I said, wouldn't it be amazing if I could do all of it, if I could use my physical therapy knowledge, use my rehab knowledge, and become a pain management doctor, so I can understand how to treat people from the beginning of the injury to the end, how to see them through and not just manage their pain, but actually manage the whole person. So that's how it came around to be.
That so cool. I mean, I had no idea. I mean, that background is amazing. I love how you're trying to use your existing knowledge, but have this amazing trifecta of solutions. Like, I'm going to treat it from this angle, and this angle.
Exactly,
That is
exactly.
amazing. So give me a little bit of the rundown of the office. Tell me, a little
Yeah,
bit about, what you do, how you do
yeah.
at Unique Pain. Yeah.
Yeah. So unique pain is unique because, myself and now several doctors that work for me are, mainly from rehabilitation background, but we also have an internal medicine doctor who happens to be trained as a sports medicine doctor and now is also a pain management doctor. So, as well as a few anesthesiologists. So we're coming from different specialties to sort of focus on the patients and to treat them from different angles while still having that same philosophy. Let's take them from the beginning. Let's make sure that the pain is controlled. And then let's make sure that they get the best quality of life, the best care, whether it's physical therapy or surgery or whatnot. So we're a very friendly bunch, mainly young doctors, youngish, I'm probably the oldest. We have two locations right now in New York, and each location is staffed by two pain management doctors and by one anesthesiologist. And of course, we have wonderful technicians that help us and amazing front desk. And I think, we have fun with our patients and with each other. And I think it translates. Patients come in and they feel happy. Like, okay, this is not a scary place where like, oh, they're going to come up at me with a big syringe. It's a friendly place where we try to understand where they're coming from and what they want to get out of this session with us.
People can really tell when the office is collaborative,
Yeah,
when people know what's going on with you, you're speaking to all different people and they're up to date on your case, what's
right,
happening, what you've done so
right.
far. And when you can come in, especially, I love how you said, we're so friendly. This isn't a scary place. Most
Yeah,
oftentimes, I'm
yeah.
sure people are coming in maybe in the worst state of their life,
Of
right?
course, definitely. Pain is scary, and some people are very injured, and they're dreading this appointment. I mean, a lot of times you measure the blood pressure, and it's like through the roof, and And that's because they're worried and they're stressed. And so our job is to immediately calm them down
Mm,
and to make them understand that this is not as horrific as they think. And we will do everything possible to get them from,
mm.
say, pain 10 out of 10 to pain 2 out of 10. And more importantly, to embrace the, the journey of like getting out of this injury and getting out of this pain together.
I love that. And kind of speaking of the kinds of pain and conditions that you guys treat, just things that I've been looking at, people typically suffer from a lot of back pain,
Yeah.
sciatica, herniated
Yeah.
disc,
Or,
and joint pain, headaches. Those are a lot of maybe some of the
yeah.
common things. But what do you find are the most common things that you are treating maybe on a daily, weekly
Yeah.
basis? But maybe what are some of the hard things, or maybe some of the
Yeah.
other conditions that you're also
Yeah.
treating?
Sure. I mean, you're absolutely right, Rachel. The widest, I would say, complaint that we see is patients with low back pain,
Mhm.
herniated discs, also known as sciatica. So
Yeah.
I would say, in average lifespan of any person out there, if you pull anybody off the street, 7 people out of 10 will have an episode of low back pain. And out of those, a majority would have severe lower extremity pain or leg pain that we call sciatica. So those are the ones we probably see the most. We also see a fair share of neck pains and arthritis. We have our athletes that run their knees out. We have people that are older that have compression, what's called compression fractures, where the vertebra start getting, kind of softer and the crumble with time. And so we actually can put that together by providing, by putting something called, as a cement, a procedure called kyphoplasty. We
Mhm.
also do minimally invasive surgeries where, we take someone's posterior they call sacroiliac joint, but essentially it's posterior hip that, the joint that connects the spine to the leg, and we put a little device in there that will allow them to be more stable and to walk better. Um, I would say some of the interesting things that maybe others don't treat as much as we do is something called CRPS, where the person gets maybe injured slightly, and suddenly, say you had a little cut in your leg, and suddenly this leg becomes, we call it, angry and red and swollen, and it sort
Mhm.
of takes over the whole body and could spread all the way up into the upper body and the chest and whatnot. So we treat things like that. They're a little bit more complicated in treatment, but
Mhm.
challenging yet very rewarding. Certainly headaches. We do treat some cancer pain, some challenging neuropathic problems. So it's a wide range of problems. But I would say, to your point, the majority of pain that we see is our bread and butter low back
Yeah.
pain.
For
Yeah.
sure. But it is nice to know because, there's people that are suffering
Yeah.
due to all different types of circumstances. And it's so, it could be cancer, like you said,
Sure.
and people are suffering in different ways. And it's so great that you have so many different treatments and pathways to help relieve them.
Right.
And, something that I thought was really interesting that you did is that your practice really seems to emphasize going opioid free and being,
Yeah.
having opioid free pain management
Yeah.
treatments. And
Yeah.
so, our world is, I feel like sometimes so dependent, and the crisis, and how debilitating that can be when someone gets hooked on opioids. And it's obviously
Absolutely.
very controversial in your space. So I
Yeah.
would love if you could maybe elaborate on some of
Yeah.
those alternative therapies that you're doing.
Yeah, so just to take a step back, when I was trained in pain management, it was all opioids, and I remember actually, while I was in training, I kept thinking, okay, so what's the end game here? Like, we put the patient on opioid. When are we going to stop that? When are we going to take them
Yeah.
off? And I could never get the specific answer. People were like, well, if they're doing well, they're doing well. The problem with opioids, though, is that if by themselves they may not be harmful, but if you continue taking opioids for months after months after months, you do get, if not addicted, you get dependent on them. So you have to just keep taking them just to keep your level of pain the same, say 2 out of 10 on the visual analog scale. And then you'll need to take more and more and more just to keep yourself on the same comfort level. So when we looked into what kind of patients we were seeing and specifically what problems they were presenting with, we realized that opioids should really not be the first line of treatment. opioids do have the certain place for cancer management, and we do prescribe that, but not routinely, and only for patients that are at the end stage of life, or patients that just had surgery. Say it's day 2 and you're in severe pain because you're physically being cut. Sure, 5 days of opioids is okay. Otherwise, for musculoskeletal pain, low back pain, there's just no role for it. There are other things we could do. We could do medications, other medications like anti-inflammatory medications. We can do vitamin infusions, which are actually quite helpful for overall wellness and pain control. And we can do injections that we provide. We provide steroid injections. We also provide regenerative medicine injections where we take your own blood. It's called PRP, little platelets we inject back into the body, and it actually really helps with pain. And not just the pain, but actually helps to heal the joints, heal the spine. So those are the things we do. And then we also recommend and work closely with physical therapists, acupuncturists, biofeedback specialists, behavior therapy people. So, we're just a small link in a kind of large association of people that work together to help them.
That's
So,
amazing because, I was actually on your YouTube channel and I saw this wonderful video testimonial of this woman saying, she was opioid dependent and you guys had helped her get off of these opioids, be, way more pain-free than she's been in a very long time. And I thought,
exactly.
wow, that is so awesome to hear because you know
Yeah,
how dependent people can get and
of
how
course.
scary that is. And then you feel like you have nowhere to turn afterwards.
Absolutely. And I think that, a lot of times the issue becomes is that these patients get blamed for something they had absolutely no role in. I mean, they were told that that's what they need to do. And I still have a few patients that I was able to bring down. But the older the patients are, the harder it is to completely wean them off. So we got to the point where they're on the like minimal dose. And I probably have a handful of those guys, and still their quality of life is so much better. The control of their life is so much better. And the aim, of course, is to get everybody off, or at least not to start with the new patients. We
Yeah.
certainly don't even offer that as a possibility.
That's amazing. I love that. And kind of on that topic, you've been told or patients are telling you that they've been told they need to do this or they've been prescribed that. And there's so many misconceptions. In all realms of healthcare and
Of course.
specialties, they all live, especially with,
Yeah.
you're using Google, your WebMD,
Yeah.
ChatGPT, you're looking at all this information, which,
Mhm.
which is great that people are invested in their
Of
health,
course. Yeah.
right?
Yeah.
But it's also scary when some of
It
the
is.
information
Yeah.
is not, it's not great. So
Yeah. I agree. Yeah. Yeah.
how do you address some of these misconceptions? What are, aside from, opioids and this, what are some other misconceptions that are constantly being brought up for you that you want to debunk for once and for all today?
Yeah, so as you said, I'm here because I need to get opioids. Like that's what I'm going to get because this is pain
Yeah.
management. Or you guys just going to keep treating me with steroids and
Hmm.
day after day and year after year, I'll never get off of this. They make the injections are addicting.
Yeah.
I will, need to be in a wheelchair for the rest of my life because previous doctor told me so, et cetera, et cetera, et cetera. And the way to address this is to say, look, today we're going to talk about you, not about what somebody else does or what we do in these circumstances. We're going to specifically look at you. What are your goals? What are we going with this? Where do you see yourself at the end of this? And what is you as a patient? What do you want to get out of this? Do you want an immediate relief of pain and then not see me again? Do you want to see me every month just to be sure that you're in the right direction? So I tailor it very much to the patient's needs and their expectations.
Hmm.
And I also make it very clear at the very beginning when I tell them, we are partners in this. If you'd
Yeah.
like me to stop at any given moment, you just say so. Because the
Yeah.
last thing I want is for the person to feel like they've been sort of talked into something or
Hmm.
committed to something that they're not comfortable with, or feel ashamed if they say I send them for physical therapy and they don't like it anymore, but they doing it because I said so, or they stopped doing it, but they're afraid to tell me. It's not like that. We're not, this is not that kind of relationship. There's no right or wrong answers here. It's whatever works for the patient and what is medically safe.
Yeah,
That's really it.
I love that. No, no judgment zone, right?
Not at all. Absolutely not. No,
And
no, of
it's
course not.
so important to have that perspective because, again, like something that we were talking about earlier, people are coming in some of the worst states
Of
they've been
course, yes.
in. And
Yes.
maybe they have stopped treatment
Yes.
or they let this go for a long time and
Precisely.
or it's their only hope. I've done a lot of things and I'm
Yeah.
coming to you. And I love how you're like, okay, forget what everyone else told you.
Right.
Let's just talk about you. Let's start from scratch. Let's talk about you,
Exactly.
talk about your goals. And I love how you immediately break down those walls and
Yeah.
focus on
Yes.
what's ahead of you, which I think is a wonderful trait.
Thank you. Thank you.
That's very nice to have and to have people be listened to, I think more oftentimes than not, people are not listened to enough. And when especially when something is really gnawing at them and they're like,
Of
this has
course.
been a thorn in my side, and everyone's ignored this, and I've said this so many times, and you can feel that within them.
100%. And I think it's also, one of the advantages of our practice is that we have a female provider and we also have male providers. And so, I would say that I probably get more female patients coming because, for whatever reason, they feel more comfortable with me and vice versa. So we try to address even that aspect of, patient population, like who would benefit more from, or feel more comfortable with that encounter.
I think it's so important. I mean, everything that you said today has been so awesome and has
Thank
also
you.
been so, I think, heartwarming for the people that, whether they're providers that are listening. And it's good tips to remember, like, hey, yeah, maybe I'm not listening well enough this month, or let's focus on the patient instead of, jumping 5 steps ahead into the plan. Have them understand what we're going to go through. There's so many great tidbits and debunking myths that we've
Yeah.
heard about time and time again. The rumor mill on what maybe pain management is. So
Yeah.
for rounding out today and
Mhm.
getting such a great overall sense of who you and your practice are for people that are seeking you know pain management
Mhm.
and looking to, get things under control, what do you think are some practical tips, advice that you would share as folks are coming to seek out this portion to help them in their daily life?
Yeah, I mean, I think that, again, researching the practice a little bit, maybe going on a website and talking to the front desk people, like I would say most practices, the person who answers should be able to explain a little bit about how this, how the process works. And then really understanding sort of where they're coming from, what their expectations are, what they try to get out of their encounters. And I think, as many as there are providers or doctors, I guess the point I'm trying to make is that every patient will find their own doctor that
Yeah.
they feel comfortable with. And sometimes it does take a few trips to different places. So for people out there, for patients out there, I would just say one thing. If you don't feel comfortable with the way things are run and you just don't feel that something, you just get that sense that something doesn't add up for you, don't feel bad about finding somebody else because we're out there and we want you as our patients, but we also want you to be happy and we also want you to come out of this experience feeling, energized and feeling equipped with skills and with tools to cope
Yeah.
and just to feel good about getting better.
Yeah.
So do your research, talk to people, and if you need to change a provider, doctor, or clinic, do so and don't feel bad. We will not feel bad if you leave. If you think that you could do and find somebody better, I think it's never a problem, and it's always a good thing.
I love it. I totally agree. I love, not only within your own practice, your MO is to advocate for the patient. It's not your agenda, what you're doing. It's constantly advocating for the patient. And you saying that right here and there, I'm not offended if you feel like, this is not going, or if you've been in
Yeah.
a situation, where it's been uncomfortable, ask the questions, get them
Absolutely.
answered. If you feel uncomfortable, say something.
Agreed.
Nothing worse than feeling terrible about where you're
Yeah.
at and
Yeah.
you don't tell anyone so they can't fix anything.
Exactly. That's exactly right.
We're not mind readers, but at the same
Mm.
time, advocate for yourself too. I think that's just as important as your doctor's advocating for you as well. So I think that is the perfect piece of advice to leave off on today. And if you
Thank
don't
you.
mind, I would love, before we officially sign off, I would love for folks to be able to reach out to you, whether it's a provider and they have questions. You're doing amazing things.
Sure.
You're helping people get off of opiates. That's fantastic. Or you have a patient that's, watching this and they're saying, "Oh my gosh, like this is Mila has an amazing background, between physical therapy, pain management, all this stuff. I want to go and see her. I want to come to New York." So please tell us where people can reach out, where they can find you guys,
Sure.
and
Sure.
where they can
So
connect.
yeah, we're on website. It's www.uniquepainmedicine.com. All the information is there. All the numbers are there. If you forget the URL, just Google Unique Pain Medicine, and the emails and the phone numbers and who to talk to is there. And anytime if you have a question, just pick up the phone. Like I said, the front desk people at my office are extremely receptive to patients' questions, and I promise you will have a good experience.
Oh, that is so amazing. Thank you
Of
so much, Dr. Mila. It has been
course.
a pleasure interviewing
Likewise, Rachel.
you.
Thank
Great
you.
conversation, and we really hope to have you on again for another segment.
It will be my pleasure. Thank you so much.
Thank you.